when I was in dental school, I was second year dental school, I received a small little grant and I could bring populations to the school. I hired a bus driver. That was my research. I hired a bus driver and he would bring people from different communities and I would evaluate their oral health. What was interesting to me very early in my life is that suddenly I see people with periodontal abscess. And I'm like, well, can I see your blood work? Because in Brazil, we do have free medical care. And people were diabetic. And they told me, well, I never knew I was type 2 diabetic. And then because of evaluations of periodontal health and periodontal abscesses, we realized that a lot of people had that condition. And that was similar for lupus. And we saw multiple lesions that were not very common in oral health. And suddenly, those red lesions, those erythematous regions, were actually involved with SLE, systemic lupus. So, this was true for cardiovascular. The vasculature of the mouth is so fascinating because somebody's dying today having a heart attack. Emergency teams will give a sublingual drug, and we're still discussing the oral systemic. Oral is systemic and it's highly vascularized, and the nerves are in touch with everything, perception. And sublingual medication will go straight to the heart and will control, somebody's heart rate immediately. And that's what medicine accepts. So through oral cavity we can have access to the entire vasculature to the brain.